Hi Kayla, I'm Caitlyn Ryan and I'm an occupational therapist, and I'm going to be working with you today providing you with a home exercise program just to help you with your lateral epicondylitis that I understand you're having a flare-up right now. Is that correct?
Yes.
Okay, so let me go ahead and take a look at it. It does look inflamed in some areas. I see around your elbow, and so I understand that you're experiencing these symptoms such as inflammation and pain during household activities, when you're cleaning the house, or during cooking tasks, and it's making those very difficult. Is that right?
Yes.
Okay. So what I would like to do today is what we call a TENS unit modality. And basically what it's going to do is it's going to help modulate any pain you're having, decrease pain, and then increase the mobility within your elbow without causing excess pain. So you're able to do those household activities and things you need to do around the house without experiencing any excessive pain. But what I would like to do first, just to make sure that you're a good candidate, is just go over a list of contraindications. Do you have any heart issues?
No.
Do you have a pacemaker?
Mm-mm.
Are you pregnant?
Mm-mm.
And do you have any history of seizures or cancer?
No.
Or blood vessel issues?
No.
Okay. And I'm going to go ahead and assess your sensation. Do you ever feel like you have decreased sensation within this area?
No.
Okay. Well, let me go ahead and assess it just to make sure. So what I'm going to do is I'm going to touch certain parts of your arm, and when you feel me touch your arm, you just say yes. Okay? So go ahead and close your eyes for me.
Yes. Yes.
Do they feel the same?
Yes.
Okay.
Mm-hmm. Yes.
And do they feel the same?
Mm-hmm.
Okay. If at any time you feel like tingling or decreased sensation within this arm, I'm just going to go ahead and tell you to not use a TENS unit, okay? We can do other modalities such as ice massage or things like that, but TENS unit is not going to be appropriate at that time. So let's go ahead and get started. I'm going to provide you with a pair of electrodes, and before you apply them to your skin, if you could just get some alcohol. You can find rubbing alcohol at Walmart, CVS. This is just to ensure that the area is clean and to make sure that the electrodes stick to your arm. Okay, and when pulling the electrodes off of the plastic, you want to avoid pulling them by the wire, okay, because that's going to damage the electrodes. You just pull from the corner. Right above your elbow, and then one right below. Okay, just like that. And then we're going to go over to our TENS unit. And these lead wires here, you want to make sure that they're plugged into channel 1, or just the first hole on the left side. And then these lead wires, it doesn't matter which one you plug them into, you just want to make sure that they fit directly into the electrodes and they're secure. Okay, and now there's a few steps to this TENS unit. They're probably going to be a little confusing at first, but I provided you with step-by-step instructions just to help you. Okay, so let's go ahead and get started, and you can follow along with me. So the first step is we're just going to go ahead and turn it on the power button, and then we're going to go to mode. We're going to hit mode until we see the TENS N. And so basically what that means is the N meaning that we're going to do sensory. So since you're experiencing a flare-up right now, you're inflamed, we don't want to do the motor part of TENS because that's going to initiate a muscle contraction and twitches within your arm, which is just going to aggravate anything that's going on with your arm currently. So with the sensory, you're just going to feel a strong but comfortable tingle, okay? You should not feel any movement or anything like that in your arm, okay? So we'll go to TENS N, and then we're going to hit mode until, or I'm sorry, we're going to hit set until we see the rate. And technically the rate can be between 80 and 100, but since we're just starting you off, let's go ahead and start with 80. And then we're going to go to width, which can be between 50 and 100, but I'm just gonna go ahead and set you at 70. And then we're gonna go down to the bottom middle button for our time. You're gonna hit time, and technically you're supposed to do the TENS unit between 15 and 20 minutes. However, since this is your first time and you're experiencing a flare-up and you might not be used to something like this, you can do it as long as you can tolerate, okay? So even though it says 15 to 20 minutes, if you can only tolerate 5 minutes, that's fine, and we can progress our way up as we go. And then you'll notice that there's no start button. So when we go over to intensity, when I start clicking the up arrow, that's going to start the TENS, okay? And this is also based on what you can tolerate. So there's no set number that you need to reach, it's just whatever that you can tolerate. So whenever you start feeling that comfortable but strong tingle, that's where you can stop. So I'm just gonna go ahead and press up and let me know when you feel it.
I feel it.
Okay, can I go up one more, or
Mhm.
is that
go
good?
up. Okay, that's good.
Okay. So, are you feeling that strong,
Yes.
comfortable tingle? Okay.
Mhm.
So that's what you should be feeling, okay? If you start to feel any pain or muscle contractions or twitches within your hand, or you just can't tolerate it anymore, all you need to do is just press the off button, just like that.
Mhm.
Did it stop?
Yes.
Okay. So that's all you will need to do, just to completely shut it off. And after this, if you notice that your pain has decreased and you can tolerate some ice massage maybe to decrease some inflammation, you might want to elevate it or wrap it in a Coban wrap just to provide some pressure, just to flush out any inflammation. And then as far as compensatory strategies, so you don't want to be lifting any heavy option or any objects or doing any aggressive motions with it while it's in the flare-up stage. So if you have anyone at home that can provide you with help with cleaning tasks, or if you can use your other hand to help you with completing other tasks, things like that, that's not going to aggravate the tissues underneath.
Okay.
But do you have any questions for me?
Not that I know
Do you
of,
feel
no.
like this is something that you could do on your own?
Yes.
Okay, well, like I said, I'm gonna go ahead and provide you with the step-by-step handout, and my name and contact information is at the bottom in case you have any issues or have any questions that come up.
Okay.
Okay,